So we'll go ahead and get going. I am Dr. Brenda Holland. I am the president of Chiro Congress. I just want to say thank you to everyone for coming today to listen to the Phase 2 report from Sharity. And thank you to all of those who've already been participating in this process. So I just want to welcome our presenters today, Carol Wick and Karen Pelot. So go ahead, guys.
Thank you so much. I'm going to just go ahead and start our presentation. And if you have questions as we go through, please just go ahead and put them, do Q&A or put them in the chat, and we'll make sure that we answer them at the end. But first of all, I just want to start by saying what an incredible honor this has been for Karen and I to work with nearly 4,000 of you to get to this point over the course of the last nearly 11 months to develop the first strategic plan for the chiropractic profession. And I just want to please take a moment and congratulate yourselves and your colleagues for not only putting in thousands of hours of time, even before Karen and I came on the scene a year ago, but also donating hundreds of thousands of dollars to support this effort. This has been something that your profession has been extremely committed to, and we're just could not have been more thrilled to have been part of this process. I also want to thank specifically the Strategic Planning Committee, who has really guided this process from its inception all the way through to today, and will continue in their leadership in the coming months. And a special thank you to Liz Klein with Chiro Congress, who has really been the person behind the scenes, who has made everything work, has made sure everything stayed on time, everybody stayed focused in the right direction, and she has just been an amazing person to work with. So with that, we're really excited today to present to you your strategic plan developed by so many of you with so many of your voices. This plan has certainly been something that, as we go through this process today, we're going to talk to you about how transparent, how inclusive this process has been, so that everyone's voice could be heard that wanted to be involved and wanted to put their input in. So with that, what we're going to be covering today is the overview of the process that we've gone through over the last 10 months, the work groups and the outcomes of the work groups and the plans that they developed. We're going to talk about what's next, because it doesn't stop here. In fact, the hard work is just coming. It's going to be part of the implementation phase, and that's going to be the real exciting piece when you start to actually make everything happen. We're going to talk a little bit about the Interim Leadership Committee and the structure for leadership and the committees moving forward, what the new committees are, because they're not the same as the work groups that we had in Phase 2. And then finally, we'll be taking all of your questions and answering anything that you have, or taking any comments or thoughts that you have about the process. So with that, I am going to turn this over to Karen.
Wonderful. And I just do want to echo that this has been just a true privilege over the last, I guess, about 10 months, as Carol said, to not only get so intricately involved in this amazing profession, but actually get to know so many of you personally. So what we're looking at here is a refresher, really, for those of you who've been in the process from the beginning, and perhaps new information for people who weren't with us through Phase 1. But we started officially back in October 16th, 2020, to be exact, with the launching of our online survey. And we wrapped up Phase 1 this year in February, mid-February of 2021. So the process itself, from the beginning, the intent of of the strategic planning committee, before they ever hired any of us facilitators or contractors to be involved, was to have a process that was open, that was completely transparent, and incredibly inclusive in a way that was really unlike anything that had been done before within your profession, and truly have an opportunity to hear from the grassroots and listen to what the profession from the grassroots sole practitioner up had to say about what their desires are. So we kicked off with the survey I mentioned before, and we had 3,415 people participate in the survey. We held key driver workshops. We held a think tank that I think many of you were involved in. We did one-on-one key influencer interviews. And we also had cohort focus groups. And those cohort focus groups really went deep into the data that the survey had given us. And the focus groups included chiropractors practicing less than 5 years, more than 5 years, students, regulators and researchers, as well as chiropractic college, leadership, and faculty. So we really tried to cover the gamut of the career paths within the profession and really have an opportunity to have them all be heard as we gathered data. So this is a slide some of you might remember from the phase 1 presentation, but as Carol and I were getting ready, we felt like this was a great one to remind everyone of. The result of the survey showed that 86% of those 3,415 participants felt like it was time for the chiropractic profession to make some real significant changes as a whole. And if you look at the bar chart there, the yellow, the orange, and the lime green, those really depict urgent, very urgent, and critically urgent as how quickly do you think there need to be changes made. And again, 86% of the respondents felt like it's time right now. And so boy, did we dive in. So we've talked about the process and the data that we got. The data, the qualitative and quantitative data from that huge survey and all of the amazing discussions that we had throughout. Through that process emerged really 4 overarching values that the widely accepted profession can get behind. And those are compassionate, patient-centered care, trustworthy, ethical behavior, honest, transparent communication, and hands-on, non-invasive treatment, obviously the hallmark of the chiropractic services. And then finally, head-to-toe wellness, whole body wellness. So next came visionary profession-wide strategic goals that emerged through all of the data gathering that we did. And they ended up landing on the chiropractic profession is unified without the demand for uniformity. Chiropractic is the first choice for health and wellness. Compensation for chiropractic services is at parity with other medical professions. And the chiropractic profession is validated and enhanced by a coordinated, accessible, evidence-based research environment. So these overarching big picture visionary goals led to 4 very specific strategic priorities that became obviously relevant if those goals were going to be achieved. And those are legislation, professional identity, research, and utilization. And these actually became the 4 work groups that we carried into phase 2. So phase 2 started February 28th, 2021, just about 13 days after we wrapped up phase 1. And we started with 4 bi-weekly, well, let me reverse that. We had the 4 strategic priority work groups. We did a call for volunteers, and I'm really excited to share that the volunteers for each of the 4 priority work groups truly span the gamut of the profession. And I think Carol will share a little bit more about that. But it was an exciting endeavor to pull these diverse, from philosophy to practice type, personality types, and, you know, truly beliefs around the profession together to reach agreements. So we wrapped up phase 2 just today, actually, is the final day of phase 2 with this overall presentation. And then we're going to be hopping right into implementation coming very soon.
And of course, the work group process itself was designed to make sure that it flowed smoothly into phase 3, which was implementation and the partnership with the next vendor, which is on strategy. So Karen and I, while we each facilitated 2 groups each group, work group followed the same process, starting out with identifying where they wanted to be with that priority in 5 years, but then also looking at who is the target market, what are the unique things about chiropractic in that area, and then also going in and looking at what is the proven process. We then started developing 3, 1, and then 90-day, 3 and 1 year goals, and then 90-day goals. So each group, like I said, had different focuses, different individuals that participated, but they all followed the same process, coordinating with the priorities that were also overlapping. And the exciting thing, as Karen mentioned, was that our work groups spanned the profession from practicing DCs to students, individuals who just graduated or had been practicing for years, researchers who spanned the globe. We had vendors, individuals who were public policy involved with colleges or regulators, even attorneys, and those that were just involved with family members who were chiropractors. So it was really an inclusive group. And not only did different types of groups within the profession make sure that they were represented, but we also had a wide range of philosophical viewpoints and approaches. So that was really wonderful because we were able to really hear all of the voices and all of the perspectives and make sure that all of that was being incorporated as we move the plan forward. Because again, at the end of the day, while not everyone is going to agree on everything, our goal was to make sure that the priorities that we set and the action plans that were set represented the things that most people could get behind and support. And I really think that you'll find that was successful. So now we're going to dive right into the priorities that we had. It took a lot of time to get there. Every volunteer, again, Karen mentioned, there were 4 work groups, 2 hours each. They had homework in between. Some of the groups met more times than just the 4 times, and lots of conversation in between the sessions. So the first group that we're going to cover, and these are alphabetical, is legislation. And this was, again, one of the strategic priorities that emerged from the quantitative and qualitative data collection in phase 1. And the 3-year goals that were developed by this work group were one of the strongest priorities, and one of the issues that was brought up time and time again in phase 1 by the majority of people who participated was we have to pass federal legislation around Medicare modernization. And that was their #1 priority in the legislative work group. They also felt, though, that from a state perspective, that every state was at a different place. And it was important to build the state capacity for public policy while not trying to tell the states what they should do, but just helping support their local efforts. And that would also then help build the ground support for passing federal legislation. Obviously, there needed to be more money. They were not raising enough money to really compete on an equal playing field with other medical professions. And there needs to be more grassroots engagement from patients to chiropractors, all the way up. So how do we get there? Well, that's where we came into one-year goals. The first one-year goal, and for this group, it's broken into 3 different sections, is to develop a plan to increase the capacity of those states. And that's going to start with a survey of each state. Then to look at what Chiro Congress, which is really charged with building that capacity for the states, to see what their toolbox contains and what it doesn't based on that assessment. And then to develop a plan to create those tools so that the states have what they need to be able to engage not only locally, but in the national legislature. The next goal is around Medicare modernization. And that is to put a process in place to create one national policy objective that the majority of individuals and associations can agree on, and then having mutual respect if someone has other objectives, but making sure everyone is pulling in the same direction. Next, again, going back to that fundraising, there currently does not exist for the profession a hybrid super PAC. And they're looking to establish a hybrid super PAC so that they can pull in different kinds of funding from different sources than currently exist. And the first initiative for that hybrid super PAC would be Medicare modernization at the national level. And then marketing and communications, making sure that there are state and national levels plans laid out and that those are clearly communicated to members all the way from the top all the way down to the grassroots level. And then that there are national marketing plans that are directed at the public to get them to support the efforts of chiropractic in public policy.
So that brings us to the professional identity work group and their goals. And professional identity, I have to say, it was the biggest work group. We had 22 people in it, and every session there were at least 19 people in it. And I'm telling you, if there could be a diverse crowd, we had it. It was amazing. So this is what the professional identity group came up with their 3-year goals. First is a professional unification without the need for uniformity is embraced. One profession with many options, public-facing messaging is active through public relations, branding, and marketing campaigns. Positive media coverage, that's spontaneous, positive media coverage is taking place nationwide. And chiropractic referrals have increased both chiropractor to chiropractor, as well as other medical professionals to chiropractors. And then we drill down to, so if this is going to be our 3-year goal, what has to happen in year 1 to set us on the right trajectory? They start with craft, distribute, pass, and publish a resolution of support for the strategic plan. Determine and secure budgetary needs, and specifically top of mind are for PR, branding, and marketing. Vet and hire a PR, branding, and marketing firm or firms. Develop and implement formal structured internal communications to sustain grassroots efforts, transparent communication, and the inclusive outreach recruitment. Develop a 1.0 evergreen toolkit for graduating and new chiropractors. And work with college administrators to gain support for the unity without uniformity messaging. So one of the things that the professional identity group worked really hard, and boy, did we have some intense collaboration during these sessions, was coming up with a draft professional identity statement that could be palatable, could be acceptable, that really the entire profession could get behind. They felt very, very strongly that nobody be excluded by this statement, that it be inclusive, and it also took into consideration all of the information gained in the data from phase 1. So what they came up with was Doctors of chiropractic are essential healthcare providers who assist the body's natural ability to heal. They are experts in evaluating, diagnosing, and managing many neurologic, muscular, skeletal, and other conditions. Chiropractors provide safe and effective care focused on improving function and optimizing the quality of life. Chiropractors are trusted members of healthcare teams that work with patients to achieve their goals through every stage of life.
Thanks, Karen. And next, I'm moving on to research. And this was a wonderful group to work with. It was great because we were actually working with folks from all over the globe, literally individuals who had just graduated from college and those who had been in their professions and were at the top of their careers. So it was a very, very diverse group. And one of the primary goals was to really merge this issue of the need for more research and a healthy pipeline of researchers with the profession's need to be able to interpret and utilize the existing research and incoming research to be able to tell the story about chiropractic and the benefits of chiropractic better. So I think they did a phenomenal job. So in 3 years, they want to increase the research career pipeline. And I was really surprised to find out there are currently about 75 individuals that are currently researchers actively researching chiropractic at this time. So we definitely need to increase that pipeline. To increase the funding for research. To translate current research into a way that can be used by the rest of the profession for legislative advocacy and public policy. And then to initiate a large-scale practice-based research, and that would be active by year 3. And for 1-year goals, it was really to identify and create a unified body to take on a leadership role and to establish a fundraising strategy rather than having it a little bit disjointed so that the researchers were out there kind of working in a solo environment. To hire that science research writer to be able to translate that research, to identify and create a distribution platform and process for all of that translated work so that it's very accessible to those in the profession. And then to establish a funded research scholarship and make sure that they've got a team on board to start looking at and identifying how to implement and launch that practice-based research study.
And that moves us right on to the utilization work group. And, you know, as we've pointed out, you know, just about everything points to wider scale providing of chiropractic services to the public and the patients that really need it. So the 3-year goals the utilization came up with are, as a profession, key performance indicators are measured nationally and by state. For example, number of referrals, utilization rates, value per patient rates. Those are, again, just examples of metrics to be measured. Targeted, segmented, strategic branding, PR, and marketing campaigns supported by data are live and positively impacting utilization rates. And so those are 2 big 3-year goals. So what has to happen in year 1 to move the needle towards achieving those? First of all, securing widespread interprofessional support for the strategic plan and publicize it. Establishing a Chirotech Consortium Committee to establish and track utilization metrics and empower the profession with reliable data to support decisions and messaging moving forward. PR, branding, and marketing firms must be secured and initiatives need to begin. And that messaging is supported and promoted by internal and outside the profession key influencers. And then finally, there's a third-party payor troubleshooting task force to be activated. And that would include toolkits and experts available by state to assist chiropractors in third-party payer issues. So what's next? We've had phase one. We did the widespread data gathering, quantitative and qualitative, to validate the common ground amongst the profession as a whole. We are wrapping up phase two right now, and that is the planning stage where we took the data and the common ground that we were able to identify and turned it into actionable goals and plans. And starting probably about 3 o'clock this afternoon, it's time to move into implementation. And that is truly where I always say the rubber meets the road. The heavy lifting, the hard work that feels like we've gone through, really probably Carol and I, our hard work is over. And now it is all about you in really actualizing and continuing with the intent behind this historic initiative. So we started out with phase two with 4 strategic priorities that we turned into 4 work groups. As the work groups came up with their goals and established 5-year, 3-year, 1-year, and then ultimately 90-day action plans, it became apparent that these 4 strategic priorities they'd been working on needed some more direct focus. So ultimately, as we move into implementation, the 4 priorities have become 6 active working committees. And those committees are the Chirotech Consortium, Fundraising, Government Affairs, the Interprofessional Communications Committee, Public-Facing Communications, and Research.
And I'm going to talk to you about the hierarchical structure of this, because obviously, if there's not a leadership structure, then the implementation phase is going to really struggle. So we're going to be having 2 different phases of this hierarchical structure. The first is going to be a 90-day implementation structure, but then moving forward into implementation, this will be the leadership hierarchy. And you can see that there's a leadership committee that will be a group that will be comprised of the chairs of the functioning committees, plus other individuals that will be selected down the road. There's going to be a project manager, will be a paid project manager assigned to make sure that this is successful and to support all of the volunteers. And then of course, we'll have our committees, which will be working under that leadership committee. Chiro Congress, at least for the next year, will continue to be on as a support system. And we've recommended that the Chiro Congress Cares 501c3 be able to function as the fiscal agent with restricted funding separated for this specific endeavor. So who is in the interim leadership committee? Well, in order to make sure that we had a smooth transition from planning into implementation, we're going to be taking the interim committee chairs, which are the individuals who've stepped up from each one of those 6 committees. They will serve on that initial interim leadership committee along with the current strategic planning committee. That way we can have that continuity of leadership during that first 90 days. So that is going to become your interim leadership committee, because strategic planning is over and now we are into actual implementation. They have several next steps that they have to complete in the next 90 days. And that's going to be to determine how will leadership be selected for that leadership top committee, as well as leaders of individual committees. How do you get to be on a committee? What does that eligibility look like? What are the terms? There also will be who will sit on that strategic planning leadership committee beyond the committee chairs. Are there other groups that we want to make sure are represented there? Then voting to appoint a chair, perhaps a vice chair, treasurer, and other leadership positions for implementation on that leadership committee. There'll be a conflict of interest policy that will need to be created and signed off. We also want to make sure that there is a plan for financial compliance, transparency, and accuracy. The one thing that has really been the hallmark of this process from start to finish is the transparency, and we want to make sure, and everyone is committed to making sure that that continues into implementation. There'll be also a need to establish consistency across the committees. How often will they meet? What will we be doing about agendas? Will there be Robert's Rules of Orders, record keeping, and all of those things? Tech platforms that will be utilized for project management and so forth. Finally, we'll make sure that that professional identity statement that Karen shared with you earlier is solidified and approved, and that they're going to ratify a national and state resolution of support, trying to gain not just from those who've currently volunteered, but across the nation, resolutions stating that they have supported the plan as it's been developed. So next, we're going to have you meet the committees.
So we're starting off with one of the new committees, right? That term Chirotech Consortium probably had a few of you scratching your head. But the purpose of this committee is really to empower the profession with data, measure the plan's success through objective key performance indicators, and support future decisions and messaging with the data that's gleaned. So Dr. Jay Greenstein, Jay, why do I do that to you? Dr. Jay Greenstein has graciously volunteered to head this committee and has amazing ideas and resources already lined up to get going, to really get objective, hard, reliable data to not only measure the plan success, but how well the goals are being hit moving forward.
And we do have in the final report that you will all be receiving shortly, the listing of all the initial volunteers for all of the committees. We just didn't have space for them on our PowerPoint presentation today. This is fundraising, and so I'm really excited about the fundraising committee. You can see we don't have any volunteers yet, so if you're interested in being the chair of the fundraising committee, please step up. That effort has already started at the mid-year conference. You may have seen the press release. There was quite a bit of money raised from state associations. We've also had several large gifts with matching opportunities. We are going to be rolling out a nationwide fundraising strategy to make sure that all of the things that have been prioritized by all of the committee have adequate resources to be able to fully execute this plan. Because we all know you can have a great plan, but if you don't have the money to hire the PR firm, to pay for the research, to run the platforms, you're not going to be able to execute on this plan. So again, if you are interested, we're going to be looking for quite a few folks to help us populate this committee, roll up their sleeves, get fundraising on several different levels in moving into implementation. Government affairs is what we used to call legislation. Now we're calling it government affairs because it is a much wider, broader public policy effort. The purpose is to advance the chiropractic profession through strong public policy and legislative action. Our interim chairs are Dr. Bill Loretti and Dr. Don Reno. Really excited that most of the committee has rolled on to the implementation committee, most of the work group, and we'll be moving forward and rapidly looking as well at that hybrid super PAC moving into the near future.
And then we have our new Interprofessional Communications Committee that will be co-chaired in the interim by Dr. Gerald Stevens and Dr. Mark Sana. The purpose of this committee is to expand and support the unity of the profession without the need for uniformity, continue to assure inclusive, transparent, timely communications are distributed and available to the grassroots level, promote and garner ongoing, widespread participation in order to succeed with the Common Ground initiatives moving forward. And then our other new committee is the Public Facing Communications Committee. And we have got interim co-chair volunteers of Dr. Michaela Edwards and Baron Hogue. And the purpose of this committee will be to create an expanded demand for chiropractic through consistent, congruent, targeted, and effective public-facing messaging.
And finally, we have the research committee, and they will be ensuring a robust research environment in chiropractic that is well-funded with a clear career pipeline for researchers to advance the body of work. And you can see our co-chairs are Dr. Heidi Havoc and Dr. Phil Paquette.
So this is a suggested workflow for those. I know I've got a lot of you that are very visually oriented out there, but you know, we're in June, we're heading straight into implementation, and it'll kick off with the strategic plan leadership committee reviewing as a group everything that we've just presented today, and getting cohesiveness as a leadership team. And then the committees will begin to work together. And you'll see here, there's kind of a rhythm where leadership meets, committees meet, and then leadership meets again. And the reason for that is so that the leadership team can stay congruent, can stay in the loop, and can be working collaboratively, which is going to be incredibly necessary across the committee divide. All of the committees point to success with those 4 big visionary goals that were established through phase 1. So that continued collaborative effort, not just amongst committee members, but across the committee lines as well, is going to be critical. So here's an example just for the next 90 days to take you to October. You'll see, interestingly, by the end of September, new 90-day action plans are going to have to be developed, and you'll have some support through the next vendor, next company that's coming in to help with implementation in getting those established.
So how do you get involved? Because this is, again, an opportunity for those of you who joined us today or might be watching this video later to really roll up your sleeves and get involved in implementation. There will be an incredible opportunity to either join one of the committees, or if you think that that's just too much given your schedule, a lot of the committees will be doing ongoing calls for short-term task forces. So make sure that you have signed up via the Chiro Congress website so that you are getting the updates on a regular basis, so that if there is a call for volunteers at any point in time and you're interested in being involved and having your voice heard, you'll be able to do that. They'll also be tracking the ongoing goals and successes on the website. So everything will be completely transparent. So it's really important that you stay up to date and stay connected. There'll be an open call for volunteers to fill the committees. Not all of the work group members moved forward, and as you know, fundraising committee has a lot of volunteers that we need, so that you'll be able to submit applications and be able to go in there and step on board right now if you'd like to. If you volunteered for at one point for one type of committee, there's certainly an opportunity moving forward to sign up and volunteer for a new committee. So with that, Karen and I are going to take questions. So anyone who has questions or would like to make a comment, would love to hear from you at this time. We just want to say before we start that it has been such an honor and a privilege, and I know I speak for Karen when I say this has just been a wonderful experience working with all of you and getting to the point where we have this actionable plan that you can now start to implement.
Carol, there are several chat messages and questions. Do you want to read through those yourself, or do you want me to pull them out?
I will be happy to. So let's see, the first questions. The recording, as Liz mentioned, the recording is going to be available, and there'll be a link. It'll be posted. It's also being streamed live on Facebook, so it'll be available there as well. How much does this process cost in actual dollars and numbers of unpaid volunteer hours to this point? The estimated costs associated with completion of the next phase. In terms of how much does this cost to date and the number of volunteer hours, it's a really good question, and something that we'll probably need to sit down and calculate. And moving forward, looking at the next phase, we have some initial estimates of what some of the first year work will cost, but a lot of what's going to be happening in that first 90 days or first 6 months is going to be going out and getting bids. Looking at PR and marketing firms, talking to other groups that are doing large-scale practice-based research networks, and making sure that there are accurate budgets for each committee so that we can make sure that there's enough money there, and we can make sure that the fundraising committee knows exactly how much they need to raise and for what. Karen, I don't know if you have anything that you want to add to that, or
no, and I missed a little bit of it. I apologize, guys. I got totally dropped out of the meeting and I just got back in. Gotta love technology. So, I'm going to stand in agreement with everything I just heard.
Okay. Can you explain the Evergreen Toolkit idea? Karen, that came out of your committee.
Yeah, it did. So the idea of that is to really equip new chiropractors, graduating chiropractors, and new in practice with tools to really help them succeed beyond what they learn through the education process. So literally how, from a, how to establish your practice, as well as different career paths. One of the important goals for the toolkit, I recall, was really helping define and establish and offer support for the multitude of career paths within the chiropractic profession as well. So the toolkit is intended to really help set chiropractors up for success. And the reason it's evergreen, which might be part of the concern, is because it's not static. So in year one, there's an intent to have the initial version of this toolkit ready, but the toolkit will continue to grow and continue to evolve. And as things like important legislative changes are made, there will be updates and things that have to happen to the toolkit as well. So they want to have at least that first version of really helpful, set people up for success as they're starting in their chiropractic professional lives, toolkit ready.
So Karen, the next question is about the professional identity statement. And we did catch that there was a little typo in there. We'll make that quick change. I think Karen read it properly.
Thinking on the fly, yeah.
Yes, the ID statement excludes sublocation and will be a tough hurdle for our entire profession to support. You did have both sides of this idea. By the way, I like it, and it doesn't exclude sublocation. So, and
that is exactly the intent. The work group, as I mentioned, this was the largest, most diverse work group, and they worked incredibly well with each other to come up with a statement that they really felt importantly did not exclude anyone. It doesn't specifically include everyone, because that becomes divisive, right? And those become things that are challenging, and somebody loves it and this group hates it. So they really, really worked hard to come to something that would be really, really broadly inclusive and specifically not exclusive of anyone.
And I also want to point out, when I saw it, I was actually real excited because, again, this is an externally facing statement, and most people don't recognize that term in their day-to-day lives. They might not even have ever heard of it. So we want to make sure that this is something, when someone reads it, whether they're in the profession or not, that it makes sense. So we wanted to keep out any kind of medical terms or acronyms or things that are just specific to internally to a profession. And let's see, Maya Gonzalez loves the ID statement, so that's great. Where is, oh, this is from Karen. Oh, it's a different, okay. There are several people that popped up that say Karen, but they're not actually Karen. Okay. Where is utilization / getting paid fitting into this chart? I expect it will be explained shortly, but of course, noting Karen, if you are reading. So getting paid and utilization, how is that involved in the chart? I'm assuming that is the organizational chart.
So yeah, whether it's the what you saw was the leadership chart, was the organizational chart, but as far as where do we get expanded utilization and more, is it at parity or on parity with other medical professions? It really falls in every single one of these categories. So this is one of those areas that the government affairs is going to have a big role in. The public-facing communications will have a big role in driving the demand for chiropractic services. The intra-profession communications will play a big role in trying to keep you all cohesive and continue to build on the cohesiveness so that when chiropractors are talking with patients and groups, it's not confusing to, necessarily. So I think that what you saw in the initial phase 2 work groups was a specific work group labeled utilization and getting paid. And in reality, moving forward, everything that happens helps to support utilization and getting paid. Yes. I hope that answers your question.
All right. Does the leadership committee get charged with the responsibility of vetting the project director? Liz, or Dr. Holland, do you want to take that? Because I know that is already in process.
I can take that. And oh, I'm sorry, I can't start my video, but that's fine. You can hear me okay, right?
Yes.
Yes, the leadership committee will be in charge of vetting the project director or project manager. What we will be looking at is developing an RFP with a scope of work, deploying that to various networks that we know would have the skill sets around leading this project and providing those services that were outlined earlier. And then ultimately, Chiro Congress will contract with that individual or organization, if it's an organization, and we will provide sort of the oversight for that. But the leadership team will be involved with the vetting.
Great, thanks, Liz. How does the professional public have the opportunity to weigh in on the identification statement? Talks about the formal consensus methodology used at Palmer, and what might be the mechanism to get feedback on that professional identity statement moving forward?
Well, I don't know that Carol and I can answer that, other than I think it's really important for everybody here to understand that literally every corner of the profession was represented in the professional identity group that actually crafted this statement. So it wasn't one-sided, it wasn't lopsided. We very literally had the entire sphere of the chiropractic community represented in crafting this statement.
And the other thing is, and in the first 90 days, there will be an effort to go out to associations across the United States, colleges, various groups, and have them basically sign off and validate and back the plan and that professional identity statement. So there will be conversation in terms of sending it out again to 85,000 people and getting feedback. I don't know that that's going to happen, but I definitely think that once you have organizations, associations that people are members and participate in or respect, validate and sign off on the plan and that statement, that is going to be part of what's going to again, make this a different process than what's perhaps been done in the past. Knowing that you will never get everybody to be satisfied, but there does need to be a unified statement that's externally facing that individuals can understand. Facebook question. What is the process of passing the football forward to the next consulting group? And will we facilitate that process? So that has already happened. Sharity and On Strategy have been meeting for months now. We've had several meetings. Part of the reason that we had the process that we had in the work groups was so that we could easily hand off to On Strategy the pieces and components that they needed, so that they could then put that into their platform, which is part of their implementation process. So while sometimes there were things that people thought, why are we doing this? It was said to make that process easy for On Strategy into that next phase. In fact, Karen and I have a meeting with them next week. So we will be working with them. I know that they've met with Cairo Congress in the past week and a half, and they're already starting to set up committee meetings and things like that. So this has been a partnership of all three of the consulting firms that have been hired through this process, that we've worked very, very closely together and made sure that our work has been complementary and has worked to intertwine with each other.
Yeah. And I want to give a shout out to Dr. J, who I see in the comments there, it kind of supplementing the response I gave a few minutes ago, is there is a specific action item also for a third-party payer troubleshooting task force to be created to really also specifically address the getting paid. And that is under the Interprofessional Communications umbrella.
And that's the other thing that I think is important to note, is that this is designed to be a process that evolves. The first 90-day action plans are going to change in 90 days because hopefully they'll all be achieved. So this is going to be a growing, changing process. There may be a point at which one committee is no longer needed and another committee needs to be added. So as this moves and reshapes itself, things may look different moving forward. The question in the Q&A is, there seems to be an implicit assumption that state associations dealing with a variety of often intense level state issues will offer resources, time, funds, etc. How does the priority to serve state association members needs jibe with a bigger and quite ambitious vision of this initiative and its organizational structure and program of work?
I'll hop in here. So actually, the only real hope that's solid with regard to the state and national associations is that they state their support for the plan. There really isn't any assumption that human resources or funding from the state and national associations will be implicitly involved. It's still a grassroots open call for volunteers and participation effort for actually making sure the action items and the targets are hit in order to achieve goals. So that one big hope that you saw a couple of times is for that ratification of the strategic plan itself, and that's publicly acknowledged that there is support for the plan rather than a specific promise for human resources or funding.
Having said that, Karen and I did present at the mid-year conference, and many of the states did come forward and provided funding for this effort, as they have in the past as well. And remember that a portion of this plan is also to build the capacity of states, but not to dictate what the state does. So the idea is to support the states and to give them more tools so that they don't actually have to go out and reinvent the wheel or struggle if they are struggling, and to be able to build the toolkits and the support systems that they need to get the things that are happening in their own states done more efficiently and more effectively. Essentially, at the end of the day, the idea is to make the entire profession stronger together, rather than having someone have to give something up to advance a portion of this plan. And Jen asked, Karen, how much are the dues for the group?
I saw that. The dues for the group are pretty hefty at 0. There are no dues to be part of this group. It is truly a grassroots volunteer. You know, the dues are your commitment, your time, your brain power, your networking resources, you know, your ability. But there is no financial cost to participate in the implementation of this plan.
Nor was there a cost to volunteer in the first 2 phases.
Nope.
But there was a lot of sweat equity donated. And I think to one of the questions, it's probably worthwhile to go back and see if we can't calculate from the beginning when the strategic planning committee started talking about this over 18 months ago, how many hours have been put in? Because I can tell you it has been a tremendous effort on the part of the volunteers.
Yeah. So I see that it is just about 5.5 minutes over time right now. So, and I think the questions have slowed down. So I think it's probably a good time for us to wrap up. And, you know, unless somebody else has something else to say, I do think we have a wrap up.
Dr. Wetzer, I think, is going to wrap up. And
I am going to wrap up. And first thing I would like to wrap up is to extend an enormous thank you, Carol, to you and Karen. You've done a fantastic job with this. The lift was heavy, and I'm very confident we would not have been able to come this far without you. So thank you, thank you, thank you. Also, yeah, well, you've been awesome, and we appreciate it.
Thank you.
Also, I would like to take an opportunity to thank the people who participated on the committees. When you talk about countless hours, I've kind of been calculating that in my head. With the Cairo Congress leadership and all of the committee groups, I wouldn't be surprised. Several hundred hours, might be approaching 1,000 hours of manpower that has been put into this. So again, I want to thank everyone who volunteered, everyone who sat on the committees, and especially those who agreed to chair and or co-chair the committees. As was mentioned, I would encourage everyone, if you haven't already, please sign up for the email updates. That's where you can not only get updates, you can watch for an opportunity to participate as we move into the implementation plan, and you can even volunteer your time, not necessarily your dollars, but your time, to the implementation committee itself. Now, speaking as far as contributions, I do want to say a big thank you to all of the people that have contributed. We raised a tremendous amount of money when we were in Florida 2 months ago. And we have had some large donations. For those people who are not aware, I would like to encourage you as an individual or your state to consider a contribution, because we did receive a large donation from NBCE. It was over $100,000. They have committed to an additional $125,000 matching donation. So if we can, as a grassroots group, raise an additional $125,000, NBCE would match that. So I put that challenge out to you. If you feel you can do it, it could be anything from $50 to $10 to a number of people in Florida did $1,000. It's really a matter of seeing what you saw today, the quality and the quantity of work that went into this plan. We feel it's very worthwhile. We feel it's very worth all of the sweat equity as well as the actual financial equity that has gone into it. So if you can see to put it in your budget somehow, we would really appreciate it. And the last thing I would like to say is, I am sure I'm going to miss some people, but I absolutely positively have to say with an enormous heart, thank you to Liz for the amount of time and the amount of effort she has put into this. She has been a true rock star. And I think Karen, you and Carol can attest to that, how many conversations the three of you have had and how much work she has done. So from myself and from our board and from everyone who's been involved in this process, Liz, thank you for everything you have done. I think that's everything. Appreciate everyone's time this afternoon. And once again, we appreciate everyone who has participated through the process. For those of you who are going to continue through the process, and we welcome any of you who would like to sign up to be a member of some of these committees. So again, thank you all, and everyone have a safe and a great weekend. Bye, everyone.
Bye, thank you.